Hi, I'm Dr. Rahman. Does where you live affect the likelihood that you'll test positive for COVID? Recent study out of Philadelphia looked at pregnant women coming into the hospital at the time of delivery, and they were tested for COVID positivity. Then they took this same group and they looked to see, did it make a difference where they lived and their likelihood of the women testing positive? And the study suggested that for Hispanic women, crowding or living in a community where there are multiple people sharing a space contributed to Hispanic women having a higher rate of COVID positivity. For Black women, the study suggested that living in a community of deprivation, meaning that the majority of the persons in the community had income levels below the federal poverty level, majority of residents did not have a high school degree or were receiving federal assistance, increased the likelihood that the Black woman would test positive, Black pregnant woman would test positive for COVID. So the findings are suggesting that the community and the neighborhood that a person resides in affects their likelihood of being exposed to COVID and testing positive. Not a big surprise, right? We kind of know this on an intuitive level. If you live in a space where there's overcrowding, if you live in a space where you don't have access to healthcare, to proper nutrition, to those things that will help to optimize your health, you're at an increased risk. So great study. It's starting to help us to look at other determinants of health, community and social determinants of health that will make a difference and potentially help us to design communities, design healthcare plans that will minimize or eliminate these disparities by first attending to the socioeconomic conditions that people live in.